Pandemic Data and Analysis, oftewel PANDA, is 'n groep ontleeders en aktuarisse wat die afgelope maand keer op keer met hul data-ontleding gewys het dat baie ander wetenskaplikes se COVID-voorspellings verkeerd was en dat die regering die verkeerde beleidsbesluite neem. Ek gesels nou met Nick Hudson van PANDA. Nick, welcome to the show.
Good evening, Valdemar.
Did we overreact to COVID?
Not just we, the whole world. This has been the overreaction of all time.
Why?
Well, it's a complicated story, but I think the biggest reason is that it started with a bunch of epidemiological models that massively overestimated the potential of this disease.
So, Nick, have none of these projections been borne out by reality in any country? I mean, have the actual deaths been much, much lower everywhere than that which had been predicted?
They didn't even get close.
So what went wrong in these models and why didn't we learn from previous epidemics?
I can't answer the latter question because I wasn't really paying attention for previous epidemics. But what went wrong in the models, there were several things, Valdemar. The first was that the guys initially ignored the most important piece of information that was available to the world, which was the experience of the Diamond Princess cruise ship. And they came out with values in terms of expected number of deaths that were more than an order of magnitude. In other words, more than 10 times as bad as what that ship implied.
Because even though the infection fatality rate for the Diamond Princess cruise ship turned out to be quite low, and many people on the boat never got COVID, and most of them had symptoms that were not severe. Despite all of that, our government team of analysts told them that we could face upwards of 350,000 deaths in South Africa before the end of the year. What are we likely to have, Nick, when you guys have predicted maybe 20,000 this year?
Yeah, I think that's still a fairly good estimate. And at this point, it doesn't really matter what the precise number is. We know for sure that all those original estimates that put us into lockdown were wildly, wildly wrong. And you can forget the idea that the reason there's a difference between those original estimates and where we've landed up is because of lockdown. There's been no study done at all that shows that lockdown has any beneficial effect on the death curves of these epidemics worldwide.
Okay, but so the conventional wisdom in the commentariat and definitely in government is that thanks to an early lockdown and a very severe lockdown and only a gradual easing of lockdown in South Africa, we've had a pretty modest death toll now of 12,264. That is precisely thanks to lockdown that we're doing so well. Unpack that for us.
Couldn't be further from the truth. It was observed fairly early on, and this is even before our lockdown was implemented, that when countries initiated and released their lockdowns, you didn't see a discontinuity in the death curve. The virus does what the virus will do. And this might be very hard for people to hear, but we knew in late March, in April, let me clarify that. If you were paying attention to the data and looking at it in the right way, it was visible as early as March that these lockdowns were not having the effects that the models predicted they would have.
So, Nick, what should government have done instead of the world's severest lockdown?
Well, the first and most obvious thing about this disease, which was known in February, is that its impact is very age dependent. So I think it's worth just backing up. At a high level, about 1 in 1,000 people who are infected with this disease will die from it. Okay, 999 out of 1,000 people who get this disease recover. And the ratios are very different for old and young people. So old people, the impact is worse than 1 in 1,000. For young people, it's better than 1 in 1,000. Okay, now, and much better. Okay, so what should have been noticed straight away is that there's no point whatsoever in quarantining the healthy people, the young people. We should have let everybody get on with their lives, continue producing all the food and products and services that give people incomes and allow them to nourish themselves and continue with their livelihoods and lives. We should have let everybody do that and taken care to do what we could to protect the at-risk individuals who are a tiny portion of the population.
Nick, on this program and in some economic circles, there were warnings from the end of March that lockdown could have severe humanitarian consequences and a cost measured in lives. How has that turned out? Because we're looking at 36,000 excess deaths in excess of that which is normally reported this time of year. What was the cause of that? It wasn't COVID, right? Are you saying it was the lockdown?
So I would just back up a little bit from that point before we attack that point, Valdemar. The thing to understand is that for the people who put us into lockdown and who had these crazy models, the situation that they're in is extremely, extremely embarrassing, okay? They are going to do everything to rationalize their way out of how they got us to where we are, because this lockdown has been a phenomenally destructive event, not just for South Africa, but all over the world. I mean, it's an absolute tragedy in the face of what has turned out to be not such a bad story, the virus. We have shot ourselves in both feet at the same time and imposed on societies all around the world massive, massive social costs. I mean, we need to put those 20,000 deaths into context, okay? We have in South Africa 200,000 deaths a year from communicable diseases, okay? Put that together with the observation that lockdowns didn't save a single life, okay, which is the likely scenario. And what are we doing? We shut down the entire economy and made it almost impossible for people for quite some time to get access to normal medical services. When our hospitals are empty, it's not because nobody's getting sick, it's because nobody's getting treated. And unless you believe that our hospitals are the most useless things, whether they're public or private, and that they never save a single life, you've got to be expecting excess deaths to arise as a result of denial of service and denial of access to medical care. At least. That's just the beginning. Then on top of that,
how concerned, sorry to interrupt, how concerned should we be about a second wave of COVID infections? Because we have seen in many countries around the world a resurgence of infections as lockdowns are relaxed.
There are two very important things to understand in this regard. Where you look at a country's curve and you see two peaks, when you burrow down into the regions, what you will inevitably find is that there's one peak for one place and another peak for another place at a different time. And you add those two together and it looks like the country is having a second wave. It's not. And you can even burrow down into individual states in the United States and see one portion of the state having a peak over here and another portion having a peak over there. And people incorrectly describe this as second waves. Another thing that sometimes happens is the first little outburst of infections is returning travelers. We had that in South Africa. But that's not really a first wave. That's just people coming back from a skiing trip or whatever, okay? So you don't actually see these second waves. It's all a load of nonsense, okay? The second thing that you have to understand is that these surges in cases that are happening predominantly in Europe are not accompanied by deaths. This is one of the examples of madness that I mentioned. Okay, the same public health officials who put those countries into lockdown and over-forecast all the deaths and didn't save any lives with their lockdowns are now on the hunt for further disaster to justify what they've done. And so they are testing and testing and testing, just like the World Health Organization tells them to do. And the tests that they use have a very high rate of false positives. So they find people. They also detect dead virus in people who were previously infected. And they find those people too. And so you have a surge in what they call confirmed cases, which aren't really confirmed cases at all, because they're mainly a mixture of false positives, recovered people, and then a few people who are asymptomatically asymptomatically infected. Okay. And so what you see is that none of those cases are associated with deaths. There are simply no deaths happening.
Nick, thank you. We have to wrap it there. Thank you very, very much for coming on the show tonight.